young African American women?
Teenagers, African Americans, homosexual.
I would guess it would be younger people, maybe in their 20s, and I've heard that black and gay people are most susceptible.
I think it's 18 to 24-year-olds, black and homosexual.
Age, I'll say in their 20s, African American, and gay people.
I think that gay population, even more so than the lesbian population, will be more affected by HIV.
I would say 18 to 24, blacks and females.
20s, African American, gay.
That's a good question. I think maybe African Americans in their mid to late 20s.
I believe people around my age, around 20s to 30s, is most disproportionately affected by HIV.
Access to contraception?
I think a lack of education about what HIV is, how it's transmitted, and lack of treatment, affordable treatments, and like things like that.
Affected. I would guess upbringing and culture is big. I guess how much money your family has and what they can provide for you and what they tell you.
Growing up in Korea, where Christianity and Confucianism are the most predominant religion and belief, I've always been told that being gay or homosexual is strictly forbidden by my parents and by the society.
Probably because they're less exposed to education where they can learn more about prevention and everything. And also, in the black community, being homosexual is more of a stigma, and so since it's hidden, they're less likely to use prevention.
Knowledge, general information. I always say straight because I know there's a myth that only homosexuals can get AIDS, which isn't true. So
I think the younger you are, the more likely that you practice unsafe sex.
Sexual orientation groups have sex. It's different. And because HIV is transmitted through blood and other fluids from the body, including semen. And
Definitely sexual education, like knowing certain like preventative methods and checkups and things like that. It's like younger people don't do it at all.
Their awareness of protection, where they live, poverty level.
For African Americans in particular, African American males, I think that culture plays an important role, or society plays an important role.
HIVs because they have more chance of having sexual relationships.
%13%.
Okay. 30.
I guess about 15%.
I would guess about 15%.
Like 30 to 40% maybe.
just 35.
80%.
I believe about maybe 20 to 30%.
Maybe 50%.
Like 80%.
0.5 to 1%, maybe.
I guess for 8%, that 8% of the group account for new HIV infections.
False.
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 I think this is false.
True.
False.
I don't think race plays a role in how people are affected by HIV.
False.
False.
So I would say that's false.
True.
True. False.
False.
True.
For the last one, I think it's true that the black MSM aged 13 to 24 account for more than half of the new infection among young MSM.
That's a very specific age range, so true.
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 I don't believe that black MSM, among the young MSM group of people, account for more than half.
True.
True.
I'm gonna say that's false.
True.
Hello, my name is Sejin Kim, and I'm a student of Emory University as well as one of the group members of this project. And to begin, I'd like to identify myself as a male cisgender man, heterosexual. And the reason why I begin in this manner is because as a group we feel that the crux of this issue, stigmatization of homosexuality and HIV/AIDS, is identity formation, in particular how society, culture, and other people can exert negative pressures on that process as well. Within America, research by Herek and Capitanio have demonstrated that Americans not only have stigmatization towards homosexuality and HIV/AIDS, but also that there are strong associations between the two. Thus, though overt expression of stigmatization towards homosexuality and HIV/AIDS has decreased over time, people still have increasing misconceptions about the causes of HIV/AIDS, in particular casual social contact with homosexuals, which is incorrect, as well as the fact that 1 in 3 Americans actually demonstrate or believe that people with AIDS, PWAs, are actually deserving of their disease. And so by interviewing Emory students, we really hope to gain an interesting perspective about the issue, especially considering that Emory students not only educated, but also are within a community that there are strong LGBT groups within the college, within the larger Atlanta area. And so to structure our interview, we had 2 more open-ended questions in the beginning and 3 closed questions at the end. And just to give a more objective measure, I'll talk about the closed questions. The first one being, what % do MSMs account for new HIV cases within America? And on average, students or participants guessed it was around 32%, but studies by the CDC in 2012 have actually shown that's around 63%. The second question was whether or not white male MSMs have higher rates of HIV/AIDS than black and Hispanic MSMs. And although participants, 75% of participants guessed that was false, in fact it's been proven to be correct, again following studies from the CDC in 2010. And to the last question, whether or not young black MSMs aged 13 to 24 account for more than half of the new HIV cases amongst that age group, that is in fact correct, and the majority of participants guessed correctly as well. But even despite this fact, I think if you were to rewatch the video, you'll see that some of the people do not necessarily feel comfortable about talking about the issue. Some of them ask to pass, and there's even one individual that admits for himself that he may lack understanding about the issue. And I think what it really demonstrates here is a difference between tolerance and understanding. Though, as has been demonstrated by Herek and Capitanio, though people may not be overtly punitizing, discriminating homosexuals with HIV/AIDS, by not actively being aware or actively engaged in the issue, it's very difficult to be knowledgeable and have that understanding to deal with the issue, as I've realized for myself. And I think this just really ties into what we've learned through our discussion with Dr. Jesse Peel, who is an LGBT activist and an HIV researcher within Atlanta. Not only that, but he's also a homosexual diagnosed with HIV/AIDS, and having been a part of the LGBT movement in Atlanta since its inception, he discussed how the stigmatization of homosexuality and HIV/AIDS not only affected his process in searching for help, but also even now how it's affected people just getting tested and looking for or reaching out to support groups that are more prevalent today, especially within the Atlanta area. And so within the research, I think what's really pushing towards is changing this discussion from being unilateral comparison between sexuality and HIV/AIDS towards a more multi-dimensional, more holistic approach. As seen in this figure by Halkitis, Wolitski, and Millett from 2012, we see that there are not only multiple factors affecting the incidence of HIV/AIDS, there being biological, behavioral, psychosocial, structural influences, but that these factors are influencing and interacting with one another, as well as feeding not only to the epidemic of HIV/AIDS among homosexuals, but also just the largest endemic problems that they face, whether that is mental health issues, drug abuse, sexual abuse, among the many issues that they have, I think it just shows that there needs to be more complication, more development of this topic within our literature. And so if anything, what we hope as a group you can gain from this video is just a better concept of not only how to deal with the stigmatization of homosexuality and HIV/AIDS, but also just any issue or any topic of gender within our society, especially when talking about groups that are discriminated. I think we like to put things into simple binaries, whether that is in sex between male and female, in gender, man, woman, sexuality, homosexual, heterosexual. I think what we just really are promoting is a limitation of our society. And so as we continue to move forward, whether you are an Emory student, whether you're a teacher, whether you're just someone on YouTube, really begin to think about these issues, really begin to think about how identity is formed and ways in which you can help people feel comfortable exploring their identities and being comfortable not being necessarily assigned to a traditional value or identity we have within our society. Thank you.